Oh, can you hear us okay, Steve?
Yeah, I can hear you. Can you hear me?
I can hear you just fine now. Is it coming through on your headphones or no?
No, I can hear you. Yeah, I can hear you fine.
Oh, great. Well, welcome back, everybody. Sorry for the delay in getting started. It is officially April 24th, 2020. I'm very excited to be back. Yes, you're back in the pink room. I'm loving it.
Yeah, I'm liking it. I'm liking the pink room. So
it gives me good vibes.
Yeah.
How are you
very
folks
cozy.
doing?
Sorry?
How are you folks doing today?
I'm tired because Ramadan just started. So
So you're fasting during the day.
Fasting and praying and doing the eating at the night and then fasting during the day. So Safi, she woke me up quite early this morning, so I'm tired.
Oh no.
So what kills it is because she's fasting as well, so I don't know how she's coping.
Little kids, they just have more energy, I guess.
Yeah. They've got a bigger reserve, right?
Yeah.
I think so. We'll see. She'll probably be like, I'm hungry by the time. She's not actually said it once at all today. She's not said it once. So see how we go. How about you guys? How are you guys?
I'm good. I mean, you're reminding me of back in the day. Shout out to my buddy Usman. I think he's I think living back in Scotland now. He was one of my really close friends. We used to do some traveling together, and I would always be surprised. I forgot. Yeah, it's this time of year. It's Ramadan, and I would go over to his family's house. They're Muslim, and in the evening it would always be like a little food party. They always had like huge spreads of food and music and hookah and the whole 9 yards.
Oh wow.
You guys whoop it up in the evenings here. They're like, we don't even drink water during the day, okay?
Yeah, right.
And they'd be up like late. Like I'd be like exhausted. Like I gotta go home and go to bed. And they'd be like, well, this is when we get to eat and get to do our thing. And I'd be like, interesting.
Yeah, it's very different, because of the lockdown. So usually the local area that I live in is quite a lot of Muslims. So the shops on the main road, they're usually buzzing all night through the whole of Ramadan. And it's just busy all the time. So now that the mosques are all closed, so but for me it works out better for me with my kids anyway, so
oh, that's good. Yeah,
so at home, so especially with my oldest one, that she's sort of like semi-recovered with an eating disorder. So I do need to be around to make sure that she's because she'll just not go in the kitchen if someone else is in there sometimes, and I'm like, then she won't eat, and then she won't listen if I say, no, you're not supposed to be fasting if you're not well. Do you know what I mean?
Yeah, of course.
It's better for me to be at home. So in a way I'm kind of like now that I'm not really missing out on anything this year.
Totally.
Which seems a bit like mean, but like that it's working for me.
No, fear of missing out is like a major thing. I'm pretty sure I forced myself to stay awake later and like go out further, just out of fear of missing out.
Yeah.
Hey,
it's got its own acronym. It's got its own acronym.
It's got its own acronym, FOMO.
Right?
Yeah,
it's got an acronym. It's got to be a thing. Right? FOMO.
Actually, I don't know if this is okay with you two to talk about today, but so my favorite ACT protocol, I wonder if I have it right here. Well, actually, so this is one of my favorite ACT books in general. I believe apart from stuff that I've written, or that we've written as well, Steve, I believe that this is the only book that has a chapter like really on the philosophy of science. So this is Acceptance and Commitment Therapy for Eating Disorders, written by the rock star who is Emily Sandoz. Do you two like? I've been noticing a lot of eating disordered behavior in my clients. Do you two want to chat about that a little bit today?
Sure. Yeah, for sure. We can talk about it. Yeah.
Are you comfortable chatting about that? Yes, at all?
Yeah, that's cool. I mean, I know we usually do like a little bit of a meditation practice, but then what do you want to do? Because we're a bit late. Do you want to dive into
No,
that?
you know what? Let's do a brief meditation, and then we can maybe sink into a bit of a clinical conversation. And Lynn is on the call. She says good afternoon in the super chat. Yeah, good afternoon, Lynn. Nice to have you live with us on the talk. Thanks for hanging out with us. Who wants to facilitate a? Yaz, are you comfortable facilitating a mindfulness exercise?
I want to go to sleep, so not really now.
Steve, are you
I can
cool
do
if
it. I don't mind.
And then you'll do our movement practice, Steve?
Sure.
Okay. And then on Monday, Yaz is going to guide the meditation and the movement practice. I'm just messing with you. I'm not going to volunteer you like that. No way. All right. So please, everybody, Lynn, Yaz, Steve, find yourselves in a comfortable posture. Go ahead and get some movement into your body if you need it. I need it. I've been swapping out my chair for different chairs that we have in the house to try and support my posture better. I mean, nothing works. I just need to sit tall.
That's why Craig Liebitson says that there's no such thing as the perfect chair. The perfect chair is the one that you get up from every 20 minutes.
Oh yeah, well I know some stuff about Craig Liebitson, so he should shut up about chairs. I'm in a real cheeky mood today, you can tell. All right, so I'd like to invite us into a comfortable posture. I'm going to close my eyes, and I'd like to invite you to close your own as well if you folks are open to that. Just checking in with your breath, noticing how your body's breathing today. And just see if there's anything that your body needs. I need a little extension through the spine, so I'm going to invite you to press through the crowns of your head, find some length in your spine. Maybe even just playing with the alignment of your shoulders over your hips. And checking in with our feet if you're able to. Maybe just adjusting the posture of your feet, perhaps moving your heels closer to being under your chair, under your knees, maybe forward a little bit. Just noticing if your body's asking you for anything in this moment. And whatever your body may be asking of you, I'd like to invite you just with a sense of curiosity, see if you can experiment with how you might respond to your body. And just notice if there's a particular kind of default attitude that you take on. Perhaps an attitude of gentleness, or perhaps you treat your body with a certain utilitarian kind of attitude. And inviting a moment of stillness here. Giving ourselves the gift of having some breaths and being present. Attending to the inflow and outflow of our breath, coming together in this space, giving each other our attention is a gift. And wherever you may be in the world, whether it's morning, afternoon, or edging into the evening, allow yourself this gift of presence. And to ask yourself, what is it that I want to be about in this moment? What's important to me? And whatever shows up for you, breathe it in. It might be important for you today to ask some questions or share something personal in the super chat. Maybe it would be a risk for you to join the call live. Maybe what you need today is just to sit back and observe the process and just hang out. Whatever your needs are that show up for you, whatever may be important to you, I'd really like to encourage you on this Friday to do what you need to do to take care of you, to ask for what you need. And let's let that be a theme today. And perhaps that can even be a theme that you pursue once we're done with this live call. There may be people in your life who could really benefit from you showing up to them and asking for what you need. Rooting down into your own values. Bringing some motion into your body, like a wiggle of the fingers, rotation of the wrists. Perhaps rolling the shoulders, moving the head from side to side. And before you open your eyes, just one last breath here with your experience. Noticing it on purpose and allowing yourself to come to this session fully connected with what is important to you. When you feel ready, opening your eyes, returning to the space. Hi! Somebody snuck in. That's awesome.
Yeah, it's a good job I was on mute because you didn't quite sneak in. There was a lot of dropping stuff as she was entering.
Bing, bong, boom. That's awesome. Oh, right on. Welcome back, everybody. Hi.
I was just asking her, I said, how's she doing with the fasting? And she's like, gave the thumbs up. I was like, okay.
Oh, good. Good for you.
You're doing good with the fasting?
Yeah.
Right on. What is your what's the first thing you're going to want to eat when you're done fasting for today?
Chicken.
Ooh. Well, what kind of chicken?
Chopped up mini chicken.
I've just made some chicken curry, so she's waiting for that.
Ooh.
Ooh. I would also be waiting for some chicken curry.
Oh, yeah. I have been making, I think I told you folks this week or last week. I should not even say that. Every week feels the same. Every day feels the same. I've been making coconut curry once a week.
Nice.
Yeah. Yeah. Oh, it's so good. It's so
Yeah,
delicious.
Adele has been making a lot of curry these days too, which is good.
Curry, good stuff. So we were going to chat a little bit about working with eating disorders.
Yeah.
So the reason why I was, I thought this, because, we've talked about it a little bit here. I've been noticing, I've been working with a number of clients who've been struggling with eating disordered behavior lately. So I thought it'd be kind of fun to talk about that a little bit. Steve, do you or have you treated anybody with an eating disorder specifically?
No, I haven't. Not in the realm of counseling. Although when I do, for those of you that don't know, I'm also interested. I do like what I'll call low-grade Ayurvedic consultations. And so for those people maybe out there that don't know what Ayurveda is, in layman's terms, I'll usually call it the Indian equivalent to Chinese medicine. Yeah. That it's sort of that sort of idea of working with our surroundings and stuff like that. But working in that field of doing low-grade Ayurvedic consultations, I really noticed that the bulk of the, and I don't want to pigeonhole females as being like the primary demographic for it, but most of the female clients that I've had in Ayurvedic situations have had some sort of disordered eating in their past. And so we talk about it, but from that particular reference, I'm not offering any real advice on it. I might just offer some tools on how to be aware of it and what are the sensations of or the thoughts around it.
Yeah.
But in clinical practice, I haven't had anybody specifically with an eating disorder.
You must work with, have people who come in with athletic anorexia or eating disorder behaviors to your yoga.
Oh God, yeah. Oh yeah. And I can even say that for myself, although like maybe a misdiagnosis by a friend who's a psychotherapist. Yeah. But I've had some eating disorder issues in the past of like when I was bodybuilding. For those of you that don't know, that I used to be a bodybuilder, which means I'm much smaller now than I was then. A lot of it was I would exercise to an extreme just so I would be able to eat whatever I wanted to. Right, that I would just pack whatever I could in, and then I would just go to the gym and just work out. So I've definitely had some of those behaviors with myself in the past. But yeah, a lot of unfortunately within the world of yoga land, there's a lot of that eating disorders, over exercising kind of stuff for sure.
Oh yeah.
Yeah, I think some of that just goes along with like the old school of philosophy of purity and cleansing, and that I think that can be really unfortunate sometimes when people just take that a little bit too far.
Yeah, absolutely. Yeah, and I thought it was really cool, as how you mentioned earlier, like about there being like an aversion to going into the kitchen when other people are in there. Yeah, because there's so many things that we can do. Pattern wise, right? Like almost like ritualistically with our eating that that can really get in the way or really be attributed with eating disordered behavior. Yeah, it's I want to say it's so funny, but that's not the right phrase. It's really, I'm noticing, quite profound, and I'm wondering if it's I read this thing the other day talking about how an article the other day talking about how young people who have been growing up in this last 10 years, I forget what generation this is called, but they are the most photographed generation ever. And we consume so much media now, whether it be Instagram, Facebook, consuming media on Twitter, on YouTube, Netflix, even like when we're at the gas station, right? I mean, there's the little TV screens at many gas pumps now. So what I'm really trying to point out here is I'm wondering if the increase in how much we're
looking at ourselves, how much we're looking at others, how much images are being edited. I wonder if that's really starting to impact how we feel about like what we see in the mirror, how we feel about, you know, how we fit into our clothes and into our skin. Yeah. And that eating becomes a natural place where we can control, because that's something that we tangibly, physically, you know, have some semblance of control over. Yeah. I don't know. What do you think? Yes. What's your read on it?
Well, I did one of my assignments in my first year. Did one that touched on eating disorders.
Yeah.
And there was, what I was finding was it's a lot of stuff about control. When there's a lack of control in someone's life, and I've noticed, like, from my just reading generally and from my noticing what's going on in my household as well, it's a lot about feeling out of control, and that's the only thing they can control. So with regards to imagery and the media, I think there's loads of studies that some of them are a bit conflicting.
Yeah.
So that it does make a difference, and no, it doesn't make a difference. So it's sort of like, but from what I've seen, there's more studies which say that it does have some sort of impact. And with regards to boys and men, the numbers are not the same as girls, because I looked into the fact that it's more acceptable for girls to say they're anorexic or have an eating disorder, whereas it's not recognised so much in boys. It's overlooked. Social sort of like norms and stuff and things, expectations of boys is that, oh, you know, they're not having an eating disorder, where it's just not diagnosed as much. Whether the practitioners are not diagnosing it, or the actual client patient are not really wanting, or
not disclosing.
They might not even think they've got an eating disorder. They might not realize it. Or they might not want to, they might associate that with girls and stuff and say, oh no, I've not got an eating disorder, I just exercise a lot.
I think it's really interesting that you're saying that, because even with the women that I work with, they will, when I'll point out to them, I'll say, that sounds like eating disordered behavior to me. And there's sort of a moment of like, really? No, not me. No, that's not what's going on here. Right. So I think that that's a really, this almost actually beautifully ties back to our conversation yesterday around this concept that, like, sometimes, whether like a DSM label or whether it be any sort of overt labeling, might be useful. Kind of like what Rebecca was saying yesterday. You know, it might actually be helpful to say, okay, this is an objective thing, right? There's some metrics that we can have here. But it can also be really stigmatizing, and people may wish to sort of, whether it be overtly or covertly, trying to hide some of those details in order to not be seen as meeting that criteria. Yeah, tricky stuff. I also know that the treatment of eating disordered behavior is incredibly difficult, and there's a lot of controversial things that are happening within that world. Demanding that clients, patients in programs maintain a certain BMI, a certain caloric intake. I don't want to use the term force feeding, although I'm sure that somebody who has experience, whether working in residential eating disorder behavior programs or as a client themselves, could, you know, of course, join us and share their experience. But I most certainly have heard tales that seem quite similar to force feedings happening.
I mean, with regards to my older daughter, I'm quite conscious that I don't particularly like telling people stories for them. I know she's not, she probably wouldn't want to come and talk about it probably.
Totally respect that.
Yeah. Yeah, she'd actually been hospitalized quite a few times due to her eating disorder, to the point where she has to have tubes in. She was being.
That's scary.
Yeah, it was pretty awful, and she was forced to basically told by the medical staff that she was not allowed to walk around. She only was allowed to go around the hospital in a wheelchair when we came to visit.
Oh, wow.
So, because it's like, you are not allowed to burn any calories at all whatsoever.
Wow.
So, it was, so that was pretty serious. And then, her emotions were pretty volatile at that time as well. So, because it's like, you're hungry, isn't it? So, yeah, you're not really. And then also sometimes psychosis kicks in as well. When, because you just not got the nutrients, your body's exhausted, and crazy things are going on. So I called up the hospital and I said I was going to get her some pasties from the shop and stuff and things like that, because I know she's not eating hospital food. I said, is this okay? And I was like, oh yeah, bring it in. And yeah, that's fine. So but there was an incident at the hospital where my daughter threw a chocolate milkshake all over one of the staff.
Oh no.
And basically in a bid to blame somebody, one of the I think one of the doctors came along to see what was going on, and she was basically admonishing me for bringing the food. I was like, I called to see if it was okay.
Yeah.
That's that how practitioners, they'll they don't want to get the blame themselves. They feel the need to push it onto parents and carers and things like that. So it's really difficult. It's like, for anybody who's got a really being an inpatient, it's like the one thing that I'm trying to do is just keep her out of hospital. You know what I mean? So
yes.
Yes. It's like just keep her out of hospital. So it's like, so she doesn't want to be there either. And I know that a lot of people who've got eating disorders don't want to be there. But then it's like, sometimes they can't manage their emotions so much, they just can't bring themselves to eat. They're just not hungry. They're so and then they get even more distressed, and they feel like not wanting to eat even more. So it's like a vicious cycle.
Absolutely. Yeah, absolutely. Yeah, that sort of like, because then does eating or the smell of food then bring up feelings of nausea or right, because because then it's not this straightforward linear kind of path.
No, it's like you're bringing up a lot of symptoms that most people, I don't think, consider, because most of us maybe have a healthier relationship with food. It's like we smell something delicious and we're like, oh my God, I want to eat that now.
Yes.
As opposed to, oh, a delicious, like a smell of a hamburger, and like, I'm gonna vomit. Or
absolutely, yes.
Right?
Yeah.
I mean, one way that she is managing to deal with it is that she's chosen to be vegetarian. So and the way that I see it is that it's just a way of her controlling things. It seems to be doing the job.
But that's working for her though.
Yeah. Oh, good.
Right on.
Kind of exhausting to me, but yeah.
Of course it is. Yeah, of course it is.
But yeah, she's worked really hard to get there as well. It's a difficulty for her to manage every day. So it's like, as long as I keep on reminding myself of how difficult she's finding it.
Yeah.
That kind of like keeps me sort of like, okay, well, I need to do my bit.
Totally. Yeah. So one of the things that I've noticed is I've noticed that mindfulness and I don't mean like present moment processes, but I mean traditional mindfulness, like actually going through whether or not I agree with, the sort of attitudes of mindfulness or not, I've noticed that going through those with eating disorder behavior clients, whether it be caloric restriction or binge eating, I've noticed that is incredibly helpful. It almost systematizes a way of thinking about approaching aversive situations and like creating a bit of a routine around it. So like one of my favorite things that I like to use is an acronym called ACE: acceptance, curiosity, empathy. And so like being accepting of whatever the difficult situation is, being curious, like, why is this difficult for me? What is it? Is it the smell? Is it the idea of like eating or the potential for weight gain? Is it the impulse to binge, like to numb out from something or to self-medicate? And then to empathize, like to actually be able to show some self-compassion for yourself and to be empathetic with yourself in that moment.
Yeah.
I've noticed that can be really, really helpful. Another sort of very simple thing that I use with my clients is I like to tell them, label it, like be able to label your experience, notice it, give it a name, label it, and cradle it, like hold it, which kind of comes back to that empathy piece.
Yeah.
In a book that Steve and I co-authored called Mindful Yoga-Based Acceptance and Commitment Therapy, we talk about how and this is anecdotal, like we don't have any evidence to support this. And Steve, I don't know if you're thinking about this has changed since we wrote that book, but one of the things that we asserted in that book that I today still firmly stand by, which is we do target self-compassion in that 8-week protocol, but we don't go there till close to the end of the protocol because anecdotally, and it may just be a part of where we live, but I've noticed that empathy for yourself, compassion for yourself is so hard
for sure. It is. Yeah.
And okay, so your thinking hasn't changed about that, eh, Steve?
No, I like culturally, I believe that for the most part we're taught to be self-critical, and that's a double-edged sword. If we use that term, like on one side, like being self-critical in a way that's productive, I think can be very helpful. Like, oh, here's this behavior that I'm doing, and I'm not being judgmental. I'm just making judgments. Like I'm being critical about the situation. But I think that our culture just takes it too far because sort of like what we were talking about yesterday about perfectionism, right? Is that we're a perfectionist-based culture where, like, even let's say in the workforce, where an employer would rather, I need somebody with experience to do this job as opposed to looking for somebody that doesn't have a lot of experience because they're not going to get the job done right the first time. And we're very much a get the job done right the first time. And if you can't do that, then right. So I think that our culture sets us up for constantly criticizing ourselves against, especially against the performance of others, right? Whether we're talking about physical performance of tasks or whether we're talking about looking a particular way, right? Having enough followers on Instagram.
That's right.
It's kind of our jam is just to self-criticize consistently. Right? It's a pattern that we learn. It's a pattern that we learn. We've learned it somewhere.
Yeah. Right? Yeah, that's so interesting. Yeah,
but the
I'm glad you
compassion
brought
stuff
that
is
up.
difficult. Yeah,
and
even when I do more traditional, if I can just throw something in real quickly, whenever I'm facilitating meditative practice, and we start to do more of like metta meditation or loving kindness style stuff, consistently the feedback that I get from most people is it's easy to send it out to somebody that's really shown me that they love me. It's super easy to send it to somebody that I don't really know. Yeah, it's difficult to send it to somebody who's been giving me a hard time in my life. But then consistently what I'm seeing is it's almost impossible to give it to yourself.
Yeah.
Right? To just send loving kindness to yourself.
Well said, my friend. Well said. Yeah. So where I've been getting a lot of mileage with this kind of coming back to like MBSR or more traditional like mindfulness training is with this whole label it and cradle it. What I've been noticing with that is it's been a lot easier to help clients not treat themselves like treating their bodies, if you will, like a tool. And it's making it quite a bit more easy to show up to their experience and to have some respect for what may be going on with them, what they may be thinking or feeling, and how that may be influencing their behavior. Yeah. Is somebody coming in to say hi to you, Steve?
It was just Ellis was coming in to get a toy.
What toy?
He got a really cool, it's called a hover ball. So it's this little ball made by Montoy, and it's just like the no-name brand of toys.
Yeah.
And it's got an infrared sensor in it. So you turn it on and it's got 2 helicopter blades on it, like a drone, and it spins around. And to keep it going up, you just put your hand underneath it, and it feels the heat from your hand, and then it pushes itself up. So it's pretty neat.
That's so cool.
He's obsessed with it right now. Yeah.
Hover ball.
Yeah.
I'm thinking I want one now.
Totally.
Do they have Dollarama in the UK? Is that like a...
Sorry?
Do they have Dollarama? Like we have Dollarama here, like the dollar store.
They call it pound for pound.
Similar type.
Pound for pound.
I'm joking. I made that up.
Oh, I'm so gullible. I believe anything. Pound for pound.
You're welcome.
Do they have that in the UK? Do they have something like that?
They've got the cheap pound stores, yeah.
Yeah, okay.
You don't go from there, do you? That don't buy like a pound store toy.
Is that where you got it, Steve?
Yeah, it was Dollarama. Yeah.
Really?
Huh. Yeah. It was $4. It was 4 Canadian dollars. I'm really surprised at how. And then there's a part of me that's like, well, there's a reason why it's $4. It's because they're not paying the people that made it appropriately.
Oh, hold on. So my Google result shows from the Girl Gone London blog, which is very pink themed. So it's fitting for the environment that Yaz is in. So one of the questions I'm asked basically all of the time by people visiting London or the UK is, quote, are there dollar stores in the UK or London? Whether you're wondering if there's a Dollar Tree in the UK or questioning whether there's a Family Dollar in London, Americans seem to be all about the cheap deals, and we want to know if we can find them across the pond. Apparently, the answer is no. Of course, there's no dollar stores in the UK and no Dollar Trees in the UK, as there are no dollars.
Dollars.
Or there are pound stores.
Yeah, we've
Same
got
thing.
Stores. Yeah, it's one of my older daughter's favorite shops.
Okay.
Pound shops, yeah.
Yeah.
What are they called though? Do they have clever names? Goods
for cheaper. Is it a pound shop?
Yeah, the Poundland is one of them.
Poundland?
Yeah, the 99p store, which is just 1p less than a pound.
That's right, the 99 quid store.
Okay. And there's Pound Stretcher, but I've noticed Pound Stretcher, although they do loads of £1 stuff, they do like kind of just cut price cheap stuff. So.
Pound Stretcher.
Yeah.
I can't get over that. Poundland, Pound Stretcher.
Poundland. Okay, Pound World is actually no longer open. It's defunct as of 2018. Oh, that's too bad. Mm-hmm. Oh, hilarious. Everything's funny when you're a tourist, isn't it, Steve?
Yeah, it is.
Steve and I go to London just to go to Poundland.
In the UK for a pound party.
Is that where you went sightseeing? You went pound stretching, yeah?
The pound stretching. Big pound stretchers over here.
Chung.
So Rebecca says, have you noticed your eating being different since being in self-isolation? Yeah.
Yep, for sure.
I wanted to tell you there's another book by Mark Freeman called You Are Not a Rock. Have you read the book? I haven't read it. Mark, why haven't I read your book? Send me a copy. I'll review it.
That's the actual name of, I think, is that his second book? Or is that the one that is called in America? Because the one that I've got is it's called The Mind Workout something. I think it's called You Are Not a Rock in America, I think. And
so he's got The Mind Workout and he's got You Are Not a Rock.
Yeah.
Yeah.
Is that the same book, or is it one version in the UK and another version in the US?
I am not sure.
I need to look that up.
I used to have Mark's number. I mean, we could just call him and be like, yo, Mark, what's up with your books?
Come on the call.
You know what I mean?
Mark, what's up?
Oh, you're like, where are you?
See, the problem is that Mark is even more enthusiastic than I am. So he'd be like, Tim, it's great to hear from you. Like, how are you, buddy? And you know what I mean? And then we would just get carried away. Okay. The Mind Workout. This book originally came out in the UK as The Mind Workout. I appreciate everybody that's asked about buying both YANAR and TMW. You are not a rock, and The Mind Workout. But if you do that, you can gift one to a friend. Oh, I think they're the same book.
Same book, different title. Okay.
I knew there was something like that because I did remember him mentioning that.
Yeah.
But I wasn't 100% sure.
Yeah, Mark is he's the real deal. He's a real sweet guy.
Yeah, he signed the book for me, so I was like, cool.
Aw.
I drew one of his little drawings in it.
That's very sweet.
Yeah. Well.
Okay, so Rebecca's saying there are 2 books. I think he was saying on his website that You Are Not a Rock is the same book as The Mind Workout, but maybe he has another book.
Yeah, he's got another one out since then, yeah.
Okay. I have not read it, so I'm sorry, Rebecca, if that's what you're asking. I used to be a kind of big time reader, but I've been pretty busy lately, so I haven't been reading nearly as much. Yeah. Cool. So, eating disorder behavior. That was a cool conversation.
Yeah, we were talking about compassion stuff.
Compassion. Yeah.
Yeah.
Label it and cradle it. I found that
labeling is so helpful.
Totally.
It gets a bad rap. It gets a bad rap these days, though. Like people are, like, don't name it, don't put a label on it. And I'm like, no, man. Sometimes the label is like, again, like the DSM stuff. It's sometimes the label is just super helpful.
Mm-hmm. Yeah.
Like I notice myself. Like I do labeling practice. Like I like to when I'm sitting practice, I like to take a chunk out of there and just name stuff and label it. And it's usually sense related. I'll just open up my attention and then I kind of notice where, like, what is the predominant sense that my attention is sort of going towards, and then I'll just label it. And then when it switches, I'll label it again. And I find that that's a really, for clients that I do give that kind of work to, I find that that's really a nice introduction, that you're not naming anything difficult. You're not naming anything where the label can get complicated.
Okay.
It's just like, okay, now it's, okay, ears are the predominant sense. Okay, eyes are the predominant sense. Okay, now there's a taste in my mouth. Okay, taste is the predominant sense. But even in my own life, an exercise that I do quite often is that when the kids are in the bath, my job is to move around the house and to tidy up a little bit, or to get the pajamas ready and the toothbrushes ready for bedtime. And I've found that I can sort of be mindlessly doing that. It's a task that I do every day. And so I'm just sort of around the house quickly trying to get everything ready so that maybe I can sit down and like surf Instagram for a couple seconds before the kids get out of the bath. And one of the practices that I've started doing is, as I'm doing that task, I'm labeling everything that I'm doing.
Brilliant.
So it's like, if I'm walking down the hallway, I'll say to myself, walking down the hallway, walking up the hallway, going into Ellis's room, turning into the closet, opening the drawer. And what I'm finding is that the labeling practice is really wonderful at slowing down.
Mm-hmm.
Because if there's a desire for me to label it, I need to move with a speed that allows me to label. So I can't just like be mindlessly buzzing around super fast around the house. Is that the labeling practice really slows me down and makes my movements much more conscious and aware. But what I've also noticed too is, and I'm going to take a cue from Joseph Goldstein, who does sit more in the traditional mindfulness sort of world, of just recognizing that so many of our experiences are happening so fast that we almost can't label them. That like sometimes experiences like bam, 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 and like if you try to label something that quick, it just doesn't work. But I like that as a recognition that sometimes we're just having so many experiences so rapidly that just the recognition of that is almost overwhelming sometimes for me. It's like, wow, I'm having so many experiences almost simultaneously. And so that was kind of mind-boggling for me when I first started that practice, was like, I can't label every experience that I have because they're happening too quickly.
So I don't know if you can see this. I'll try and hold it up nice and close to the camera. Maybe it'll grab focus. Maybe it won't. It continues to not want to grab focus.
Yeah, I've seen
one of
those.
Is it like a click timer?
It's a tally counter.
Yeah.
So I think that this is a great way to introduce yourself to the world of exactly what Steve is talking about here. I'm just going to reset it to 0. And being able to, and I usually have clients start with sensations.
Yeah.
Just clicking for each sensation that you're noticing. So whether it be something that you're feeling inside of your body, a sensation like a sound, or whether it be a touch sensation. And, they start even getting to the ninja level when they do like a double click, because they're like, oh, well, I'm noticing, let's say, the lens of my camera, but then I'm also noticing myself clicking on like the sound of the clicker, right? Yeah. So that can be a pretty interesting
that's a cool tool. I'm going to have to get one of those for sure.
Yeah. Tally counter. Quite cheap, but really great for exactly that kind of labeling activity. Absolutely. Yeah. It's interesting because there are many RFT interventions. Perhaps another plug for a book in case people are really interested in this stuff. I've got a series of books here. I'll just grab one. They're pretty not easy to work through, just as like a casual read, but the Peak books by Mark Dixon. So what these are is they're a relational framing training program. There's 4 different books in the series. If you're really interested in getting into like a deep nerdy dive into some of this labeling stuff, I would say there's a really great RFT account in the equivalence training modules that are great. But also in a book that I co-authored called The Acceptance and Mindfulness Toolbox for Children and Adolescents, there's a ton of labeling activities in there, but there's growing empirical support, right? Like through RFT for helping people to do this whole labeling thing, or to use the more, behavioral precise term, tacting. And even doing some different, like really interesting, like discrimination tasks. So as far as labeling goes, like whether it be the tally counter, sometimes I even have some Ziploc bags with cotton swabs in them that I put some essential oils on, and doing some labeling, some discrimination training with different scents as well.
Nice.
It'd be pretty powerful.
I have a tool that I use sometimes for people that don't want to label, because sometimes people will have a difficulty with that. I find is that they don't want to put labels on things, or they don't want to make judgments about things, whether it's the term label or judgment has a sort of is misconstrued. One thing that I'll do if they don't like to label things is that I'll give them like a Tibetan singing bowl. And every time their experience changes, rather than labeling it, they just ding the bowl.
Oh, so interesting, Steve.
So they recognize that they've had a label that their mind has put on something, just automatically, the mind will label it. And rather than turning it into something terrible, we give it a really nice sound. So it's like the labeling is followed by, like a really pretty sound.
That's so cool.
This is a way to sort of shift the attitude towards it, right?
Yeah. And so how we got on to talking about this traditional kind of mindfulness training, this labeling, is we were talking about what we find works some traction with eating disorder behavior. So that's what I find is extremely helpful.
Yeah, when you guys were talking about that, I just clicked and remembered that because I do so many extracurricular stuff at uni, sometimes I forget what I've done. I did. Do you know what a VRA is? Do you lot have that? Voluntary Research Assistant?
Oh no.
No.
Basically, as an addition to when you're doing your degree, you can do like a 6-week stint where you work with one of the academics on one of the projects that they're doing.
Okay.
So last year's summer, during before my kids broke up for the summer holidays, I thought, okay, let me try and fit that in, because it's a quantitative study, and I know that I was doing qualitative for my dissertation, so I wanted to get a bit of quantitative in there. So it was on eating disorders.
Okay.
And when you were talking about labeling, it reminded me about the actual study, because they were talking about, I can't even say it properly, alexithymia.
Yes.
That's the one. So it's like the difficulty of recognizing feelings and emotions, isn't it?
Yeah.
Something like that. So we was doing the study on that, and then was noticing that quite a lot of the people with eating disorders recognize disgust the most.
Interesting.
So feelings of, so I've noticed that I've been more aware of that when I'm dealing with my daughter. So when you bring in that stuff about labeling it, and I was like, okay, well, my older daughter, she is more self-aware nowadays. She is able to recognize her emotions more, and I think that's the thing that's keeping her out of hospital. Being more aware and more in tune to her emotions and recognizing things early. And putting things in place to help her self-soothe with those things, putting, like, whatever she uses.
That makes perfect sense to me.
For sure, absolutely. Like, that's for me, that's one of the biggest parts about being a parent right now, is helping my kids talk to their emotions, right? Like, because if that's one of the starting points of the behavior, right? It's like, if we can get to that quicker, as opposed to being like 5 leagues out to sea before you catch a problem, right? The sooner that we can catch it. Like, I know with my son right now, the conversation that we have is, can we tack to when one emotion or one feeling turns into another feeling? Like, when does disappointment become upset, and when does upset turn into anger?
Yes.
And that's one thing that we'll talk about. Is like, it's cool to be upset, and it's okay to be angry, but then being aware of like how, and then if anger pops up, then what do you do with that?
That came
and
up.
He's getting really good. Oh, no, go ahead, Yaz.
That's really good, like, you're doing it with your kids like that, and starting from young, because that really sets them up for the rest of their lives. So it's amazing to hear that.
I never got that when I was a kid. So
but then I had some recently. I had some EFT therapy. Emotional freedom, the tapping thing.
That's right.
He talked about my therapist. She was talking about, she goes, right, so how do you feel now? What is that emotion that you're feeling now? And then she's like, she goes, has it changed slightly? And because I was like, she's saying, on a scale of 1 to 10, what are you how are you feeling about the same issue before we started? And I was like, okay, well, it's like 7. I said, well, actually, I'm not really feeling the same emotion. She goes, it's shifted then, hasn't it? So it's like really noticing about your state of mind and your emotions shifting about the same subject, the same topic, same situation, sort of like shifting. So I was like, okay, so becoming more self-aware really does help you understand, regulate yourself more, and say, oh, okay, noticing things more. That's the most important thing, really, just being able to notice and recognize, so you can sort of like just acknowledge it.
That's very nice.
Thank you.
It creates such an important foundation for everything.
And I would argue that is also it's funny because some of the discourse when people are like learning ACT is they tend to want to kind of polarize things, like put them in a frame of opposition to ACT, right? Like CBT is not ACT because of this, or EFT, this tapping is, oh, well, that's not empirically supported. But I would actually argue that that's very ACT consistent, because You have some kind of an emotional experience or some kind of cognitive, private kind of thing going on. And then you're helping people to expand their repertoire in the presence of that and have them notice, right? In a frame of comparison, how is now different than then? How is then different than now? I think that's incredibly savvy therapy work, very clinical, very savvy clinical work is what I mean to say.
Yeah, it was quite helpful. But what was most helpful that therapist were doing with me was EMDR. But then it just wasn't effective online.
Yes.
So I was like, okay, so you know what? I said, we'll shelve it for a bit.
Yeah. And you'd have to be quite a tech savvy therapist, but there are ways that you could get, like using open broadcasting software, OBS, where you could have your client wear headphones and you can do bilateral stimulation through the headphones, like left and right channel.
Wow.
Cool.
Yeah. And there's probably there's got to be apps for that on Google Play and on the Apple App Store and things like that.
Yeah. I think that was in the before the official lockdown started. So we sort of had an online session, and she goes, "Oh, I've not done anything like this. She would just test it out." So we had a bit of a test, and I was like, "Nah, this ain't working."
No, yeah.
So we did an EFT session, EFT based session. So cool. that was okay, because we're going through the same difficult stuff that I've not actually been through not actually discussed through therapy before.
Yeah.
Some of that a particular serious incident when I was married. So regards to what my ex-husband, see, I can't even talk properly when I'm talking about it. So
you've been stammering there, eh?
Yeah, so I do that a lot. I noticed I do that a lot when I'm
Your
talking.
stammering is welcome here, yes.
Yeah.
It's I mean, yeah, I haven't fully dealt with that, and I haven't gone through my previous therapies. I haven't even got to the stage where I can get to that. So it's nice that I was able to sort of start dealing with that, but yeah, put that on hold until things are a bit more normal.
Yeah. I thank you for sharing that.
Thank you.
I don't mean to have us run too late. I know that we started late, so I hope it's okay that I throw this out there. So I've done the EMDR training myself. I don't know if you have an interest in that, Yaz, or yourself, Steve.
Super interesting.
Yeah,
I think it's very interesting. Yeah.
It's totally, yeah. My concern about the training is this. Because it's very technique based and not process based, I think it becomes hard for therapists to feel like they can make the practice their own and be creative with it. So for example, doing an online session, and the joke that I like to make is EMDR is a great way for therapists to give themselves bursitis because they're constantly wagging their finger, right? Sorry, bad joke. And for those of you who aren't maybe aware of how EMDR works, the theory is bilateral stimulation. So when you're growing in utero, the brain as it grows, it vaginates into a left and a right hemisphere. And so the theory is that the corpus callosum, the fibers that attach the left and right hemisphere to one another, are not working efficiently when trauma occurs, and that trauma memories essentially get stuck in the brain, and that the brain isn't fully communicating. And by stimulating the left and right hemisphere, by having people move their eyes from side to side following a finger, or putting headphones on them and having a beep in this ear, then beep in this ear, or putting little almost these little circular vibrating pieces. You could hold them in your hands or put them on your knees or in your lap, or even just a therapist tapping left knee, or right hand, left hand will stimulate that communication between left and right hemisphere. And then what essentially will happen is the brain creates new synaptic connections and becomes more efficient. That corpus callosum becomes stronger, and the brain, the exchange of energy is more bidirectional, and that the trauma memories become unstuck. What's interesting is, again, it's an interesting theory, very heavily technique based. Keep in mind though that EMDR has the same effect size when you remove the bilateral stimulation. So if you have somebody there were some experiments done where, clients would stare at a ring that the therapist was wearing, or they would do it with blind patients and have just the therapist kind of go through the description. So really, I think one of the takeaways from disassembling EMDR and doing some studies on it, I think shows us that it's just good old fashioned imaginal exposure. And that's, we've known since the 50s, right? There's a ton of empirical support for working with trauma, phobias, and all kinds of aversions using exposure. And so I would say, hey, EMDR therapists, maybe take my ACT for Addiction course. Remember, it's process-based. You can apply it to anything. It's on my website now. If you want to sign up, it's on sale. Shameless plug. I would say like EMDR therapists who learn some of this process-based stuff could start more freely and flexibly applying the EMDR protocol components that work for them in their practice, and really start getting flexible with how they roll out EMDR with their clients.
Yeah, she did actually use a imagery technique with me. A cinema theatre. Have you heard of that one? A projector and a cinema theatre. She said, "Oh, imagine you're sitting in the theatre watching a black and white movie of what happened, the scenario." And she goes, "The projector is in a booth up there projecting it." And she goes, "Imagine yourself
watching
the projector." And then she goes, then imagine yourself in the actual situation. And she was doing EFT on me whilst I was
watching.
Yeah.
That is so cool, Yaz. That is good therapy.
Yeah.
So yeah. So
Oh,
and that sounds like diffusion and self as context work to me.
Yeah.
Yeah, that's perspective taking, right?
Yeah.
It was pretty cool. I was like, okay, yeah, this is cool.
Yeah, it sounds like you have a pretty damn good therapist.
I've never thought like the EFT stuff while doing that visualization, but I do that visualization often with clients.
Yeah.
What she was doing is she goes, imagine that you're talking to yourself who's in that situation, and you're doing the tapping on her, and she was doing the tapping on me. And she goes, imagine you're tapping on her in the same way. So I was like, wow, that was pretty cool.
This sounds like a very talented therapist that you're working with.
Yeah.
She's actually one of my friends who used to be my neighbour. It's her sister. I didn't know she was a therapist, or I've forgotten she was a therapist. Yeah. And I was in my friend invited me to like a training session for EFT, and then she gave a special offer for anybody who wants to have any therapy. She's doing like 5 sessions for like £100, which is like super cheap.
Yeah.
I was
like, super cheap.
Yeah, book me in for me and my daughter straight away.
Yeah, totally.
So Mariam had the same therapist as well. So, and she really found her helpful.
That sounds phenomenal.
Yeah, so it was pretty cool.
Wow. Okay, we got to wrap up for today. Steve, you want to guide us through a brief movement practice?
I do. I want to have some fun with balancing today. I thought we would do some balancing stuff. So yeah, I'm gonna shift my camera, and we're gonna come to standing. So it's gonna be some standing stuff today.
Cool.
All right. Okay. So nothing overly complicated today. So from a standing position, and the question that I ask in yoga classes very often is that if balance is not your greatest ally, where could you go? And the answer, as always, in the yoga room is that you can go and put your hand on a wall if you need to. So you might stand by a wall just for assistance, or if you have something like a chair that's close by, if you know that you're not super good at balancing. And what you'll do to start is just to lift your left foot off of the floor. So you're putting your weight onto your right foot, your left foot is lifted. If you need to have a hand on something, that's fine. Another option might be to keep your left toes just in contact with the floor, so that the left foot kind of helps with the balancing. But again, the bulk of the weight is going to be on the right leg. And then just to take a moment to feel the right foot on the floor, or whatever surface it's making contact with. And what I want you to try to notice to the best of your ability is what we call the three corners of the foot. So the ball of the big toe, the ball of the baby toe, and the center of the heel. Those are the three: ball of big toe, ball of baby toe, center of heel. And I want you to try to notice how when you move out of balance, that one of those three corners is going to fluctuate quite a bit, whether it's the ball of the big toe, baby toe, or center of the heel. And so just noticing that, and trying to make some of the balancing corrections down on the foot and the ankle. Right? So rather than like the natural tendency is to really get the upper body involved as the way to bring ourselves back, and instead could we start to make some of the corrections down there, right, within the foot and the ankle. Good. And then take a break. Good. And then switch sides. So you're going to be lifting the right foot. If you need a hand on something, that's fine. If you feel like you don't want to put a hand on something for whatever reason, just notice that. I don't want assistance. I have a hard time asking for help.
Whoa.
And then feeling again for the three corners of the left foot. But maybe also noticing things like it's easier to feel one foot as opposed to the other. Or that balancing is happening more easily on one side than the other. It doesn't mean you're broken, it just means you're human. One hip that's more coordinated, one foot or ankle that's more stable. Good. Start to make some of the corrections down on the foot and the ankle. Good. And then both feet down, again, a little shake. And then I'm gonna invite people to choose what foot they do. We're not going to do both feet today, but I'm going to let them choose which foot you decide to put your weight on. So maybe it's your good foot, right, or your bad foot. Right? And so you're going to lift one of your feet off the floor. And automatically that's going to start to translate into more muscular kicking, more musculature kicking in, right? Feeling how balancing is happening. Doing your best to make some of the corrections down on the foot and the ankle, the standing leg. And then here's the fun invitation. You do not have to do this, but you might close one eye. As you close one eye and you start to limit your visual field, noticing how the standing foot and ankle is going to start throwing more information at you. And then if one eye closed feels accessible, maybe one eye closed and one eye blurred. And just know that wavering and possibly falling over is normal. Can you still make most of the corrections down at the foot and the ankle? And then the last level would be both eyes closed. And know that it's totally possible to feel your foot on the floor and to make corrections, and for your mind to be like, holy shit, this is difficult. And to feel your standing hip working really hard. Good, and then we'll lower the foot down, open both eyes if they're closed. Shake it out. Yeah, I mean, that's it. That's it. Just a fun little exercise in balancing.
Steve, it was way easier for me to to do eyes closed.
Was it? That's cool. See, and I think that's really interesting. It's like we can't say that somebody's experience is going to be like that. Like,
Yeah.
Some people might find the hardest thing the easiest thing.
Yeah.
Right? And I think that's okay.
Yeah, that was cool. Thank you, Steve.
So for this April 24th, 2020.
Yeah, I didn't hear that.
I said, oh, thank you, Steve. That was really good.
Oh, good. You're welcome.
I was just saying for this April 20th, 2020, thank you all for joining us. Yaz, thank you for being here live on the call. Steve, that was a wonderful movement practice. Great discussion. To our friend Laura, to our friend Ollie, Lynn, thank you for joining us. Lynn had to dip, but she says she's going to catch up later. So hope you're having a great day, whether I'm assuming you're probably at work. And Rebecca, nice to see you. Hope everybody has a great day. Laura, wherever you are in the world. And of course, to our friend Vicky as well. And Xenia, hope you're doing okay.
Yeah.
Have a great day, everybody.
Take care, guys.
Good session.